Is the Astrazeneca vaccine safe? Well, many have been asking that question, and health officials are educating the public about the vaccine before it arrives in country. In the United States, more than 40 million people have been vaccinated with Pfizer and Moderna, the two authorized drugs by the Centers for Disease Control. The Bahamas, however, will receive more than 100,000 doses of AstraZeneca that has been approved by the World Health Organization. Deputy Chief Medical Officer Dr. DeLon Brennan joined Daryl Miller via Zoom today to answer questions about the vaccine.
What do we actually care about? What are the things that we want to make sure the vaccine allows you to do? And then when you look at the AstraZeneca vaccine and the clinical data, scientific data produced around it, the important thing is that it reduces the amount of transmission from one person to another. It reduces the incidence of serious disease, like those people needing to be hospitalized, and it reduces the amount of death. That's what you want the vaccine to be able to do. And when you look as a head-to-head comparison, those vaccines, the Pfizer, the Moderna, the AstraZeneca vaccine, perform very similarly. So there isn't this big sort of 20% plus gap between them when you talk about reducing the amount of severe disease and death. They all perform exceedingly well at doing exactly that.
Meantime, Dr. Brennan emphasized the government's policy.
The vaccine is absolutely voluntary for even if you are in the highest priority and you are a frontline health worker who is seeing, COVID-19 patients every day. It is not mandatory for you to receive it. I think those of us who are on the front line and, persons who are seeing them are going to be the ones who are signing up for it to receive it as quickly as possible because we see what the ramifications could be. And we want to not just protect ourselves, but I think, just being a part of healthcare as a whole lets you know that you have to be a part of taking care of and protecting others. So what people don't necessarily want to do in that situation is take it home to their children, take it home to their spouse, take it home to their parents or grandparents. They want to protect those persons as well in their households, in their community. And even if you yourself don't feel as though, I need to be able to be the one to take it, I need to make sure that, I protect all of those others who I may come into contact with.